Okay. So I guess, and we can go offline and talk more about this, but we don't have a firm number about how many units have been brought online for individuals. If you just want to use Sonoma, I'd be happy to just use Sonoma for those who are transferring out in the community.
That are open and ready to accept individuals into the home, it would be a capacity of less than 40 that are open and ready. And there is transitioning that is currently taking place right now, and individuals are moving into those resources at this time and have been in the previous months.
And we are projected to have everyone housed by the 2018 date.
That is our belief, because the regional centers with those 132 projects are much further ahead in the process. We had established in previous closures all of the housing processes in regards to legal documents for housing, the nonprofit housing organizations that actually make the purchases of the homes. All of that is so much further ahead than it had been in previous closures.
Okay. And we could sit down offline just to kind of go through the numbers directly. I will not drag it out here, so I appreciate that. And then when we do sit down, we can also talk about the tracking, because I think that brings up the whole other issue of all items regarding services within the community. Thank you so much. Sure. And the last item I have is, what about the possibility of using department staff for a mobile health and crisis team? Has that ever been discussed with previous closures, and is that on the plate for discussion right now?
It's something that has been considered for previous closures. I know when Ag News was planned to close, they were looking at that issue and whether that was a possibility. It's something that some of the regional centers, they do have mobile crisis teams, and it's something that we are looking at as a possibility for part of this closure as well.
Okay. And then, Mr. Doyle, I know this is a common theme for me today, and no offense to you, sir, but I guess what I'd like to be able to get beyond is just, we're looking at it, we're studying it, it's an important issue to, here's where we're going to go, and here's the range of time that we're going to be able to get the agreement in place. And that's because the concern continues to grow as we move further into the year, and I'm sure it's internal as well, and we're not seeing staff being retained and firm commitments being made in regard to services and or housing in the community.
Understood. And as I mentioned, you know, this is part of the deliberate process of budget discussions and developing resources and getting approval to move forward with things. So we're looking at these things, and I do understand the frustration that we don't have things in place given the time frame. But we're confident that we are moving these things forward, and that we will find ways to address some of these concerns.
Okay. And then the ICF question, that's something else that we can follow up with you on. We have 56 beds for 38 million people across the state, and looking at a potential reopening of an ICF in Northern California. That is an option that you're currently exploring?
Well, no, that's an issue that's been raised, whether we could develop something like a Canyon Springs North. That is, it's something we're aware of, and it's something we're willing to discuss as we move forward. But right now, we don't have a proposal to develop a facility like that.
Go ahead, I'm sorry.
I was going to say, we think that some of the new model homes, particularly the delayed egress, secure perimeter homes, will be helpful in addressing some of the need that we have in the community so that folks, rather than ending up in Porterville or Canyon Springs, may be able to find homes in these models.
Okay. Senator, did I see you grabbing for the mic?
No, you did not.
Okay, I apologize. All right, please, Ms. Hancock.
I just have to say, as a member of this committee, I came in wanting to learn more. makes me a little nervous to have the lack of specificity. I hope that Senator Mitchell is going to look into these issues more during the budget process. I have a lot of constituents that are quite concerned about what's going to happen in developmental services in general and the closing of the centers, what's going to happen with the regional centers. And I would really like to know, 49 million, 8.6 for Sonoma, how many in place, how many in planning stages, how many estimated to be online. Without those things, it feels like we're swimming in a fog. So just as a very concerned member, I hope that we can get some answers.
Understood, Senator. And again, we're happy to walk you through the detail. It is fairly comprehensive. As was mentioned, that $49 million is specifically for developing resources for Sonoma. The proposed governor's budget contains an additional $80 million for resources at Sonoma, Fairview, and Porterville. And this is in addition to the $68 million in community placement plan base funding that is contained in the budget. So we have this detail. It is extensive, and we're happy to walk through it.
Are there enthusiastic people out there really trying to put it in place? Are there barriers that we could help with? Are things on target? That's what I was hoping to find out more about.
We have, as I mentioned, we meet monthly with each of the regional centers that are involved in the Sonoma closure to get detail on them, on the status of the projects. You know, what kinds of issues are they running into for the homes and services that they're trying to develop in the community. We also get a status update on each consumer that regional center serves so we can understand if their situation has changed. So we're working towards, you know, we have, they've identified transition dates, proposed transition dates for individuals, but because it's an individual process, it will be dependent upon whether that individual is ready to move, whether the home that's been proposed for them is acceptable to them or their family. And so those are the things that, you know, while we can make certain plans, we can't plan on how an individual or their family may react to the home that's developed for them.
Yeah, I think it would be interesting at some point to know how many homes you've developed that appear to you to be adequate nurturing places for people to be that are turned down, because then we may have a communication issue or something else that needs to be resolved.
And we do work with, when that situation arises, we work to see what kind of resolution is available, to see if there is a way to make the home work for that person. At the end of the day, if it doesn't work, then we look for other resources.
Okay, thank you.
Thank you so much, Senator. I agree with you. Senator Mitchell.
Thank you. I would just add, Senator Hancock, that the department submits to the legislature, they did this past fall, October, the closure plan for Sonoma. We're anticipating the plans for Porterville, Fairview in the spring, in April. Yes. And, you know, the reality is those plans have to be approved by the legislature. And so while it would be very helpful sooner rather than later that we get some of the specific answers to the questions, Senator McGuire's concerned about can it be done in 2 years or not. The key phrase, word in that phrase is approved by the legislature. So that will mean it's going to be up to the legislature to make sure that the plan is feasible and meets the standard that we establish as acceptable.
Thank you.
Thank you. And I do want to say thank you to the Senator again for all of her work on Budget Sub, because I know that is where the buck stops, and watch out for Senator Mitchell. Have many of the same concerns as the Senator. And Mr. Doyle, I really appreciate you being here today. I think being candid, and I appreciate all the conversation that we've had, I would be challenged to be able to support the plan with the lack of specifics that we're hearing here today. And I guess I would have thought that providing the department where we wanted to be able to go with this hearing, that there would be additional specifics that would be coming back to this panel so that we can get into a substantive discussion on this issue. Senator Mitchell's absolutely right. It will be coming before the legislature, and it'll be at our prerogative. I will say I have a real challenge to be able to support it if this is the way we're going to continue to go down the road, the lack of specifics regarding services and housing and programs. So I would hope that we're going to be able to work closer together. And I think the really important piece of all this, our number one priority has to be residents and making sure that they have the tools to succeed in the years to come. I know that's what you want, but it's hard for us to be able to do the job if we don't have specifics about how this transition is going to work. So, Mr. Doyle, do you have any other closing comments? But before we do, see if there's any other questions or comments from this panel. Mr. Doyle, do you have any closing comments?
Again, I understand your concerns, Mr. Chair, and I appreciate the fact that it can be a frustrating process, because when you think of a plan, you think, okay, this tells me this is when people are going to move, this is when we're going to have houses developed and things like that. I think the reality of it is that this process is a little more fluid than that. When houses are being developed, the nonprofit housing organizations can run into issues that create delays and create problems. We try to work through those as those problems arise. And as far as the residents transitioning, again, you have my assurance that no one will transition until we're comfortable that resources have been developed in the community and that it's safe for an individual to transition. That's the position we've maintained from the initiation of this process.
No, and I appreciate that. And I think that, again, this is why I think this timeline is unrealistic, because we are dealing with people's lives and there are a lot of challenges. It's going to be more than 3 years. And just to point out, on Lanterman, the state transferred 16 to the ICF, despite the fact that when that closed, despite the fact we actually had other developmental centers to be able to turn to. So that's why I would hope that the department's going to be focusing on an ICF for Northern California, because despite the fact we had other developmental centers, we needed to be able to turn to that Cathedral City for 16 placements. So just an item. Mr. Doyle, thank you very much for being here today. Thank you so much. Thank you, and I look forward to seeing you back down. Thank you. We'd like to be able to move forward on our panels, and this next perspective, we're going to hear about challenges faced and lessons learned from previous developmental center closures. We're going to hear from the perspectives of regional centers. We're going to hear from the gentleman we just heard from just now, Mr. Doyle. We're going to hear from a vendor perspective, advocate perspectives, as well as consumer and family perspectives. We're going to start with Lucinda Galazza, who is the Client Services Director for the San Gabriel Pomona Regional Center. She is going to be pitching to welcome for the director who had another meeting he had to go to, and he sincerely apologizes. We also have Jim Burton, who's the director of the Regional Center of the East Bay, here today. Of course, we have Mr. Doyle. We're also going to call up for our first panel Kobe Pizzotti. He is a consultant with the California Association of Psychiatric Technicians, and we'll also have Dr. Ann French, staff physician at the Sonoma Developmental Center, to be able to join us up front. To be able to kick us off, Cinda, it's good to see you, and thank you so much, and you have 5 minutes, ma'am.
Thank you. Good afternoon. I apologize, our director had to take early flight.
Yeah.
Thank you for the opportunity to be here today. We did transition 73 individuals to the community during the Lanterman closure, and we're very proud of the collaboration with our families, our service coordinators, our providers, in an effort to support those individuals moving from the developmental center. It was through their exceptional effort, notwithstanding some trials and errors, that we were able to transition everyone to a community resource, and not one individual was transferred to another developmental center. And today we're going to talk a little bit about challenges and some lessons learned. First and foremost, I think it's important to have communication and collaboration with all parties and all partners in the process. That goes without saying, so that the transition can be a good one from our clients moving from a developmental center to the community. In regards to public policy, we are glad that there is now public policy, because during the Lanham closure there was not, and so that caused a little bit of delays and a little bit of concerns. Because there was no public policy at the time of the Lanham closure, there was a sense that families were going to be able to return back to the developmental center, or that Lanham wasn't going to close, and so that sometimes caused some false hopes. So it's good that there is public policy now to address the developmental center closure. In terms of timeline and impact to service provider, the delay in identifying the transition plan really delayed the development of resources and ultimately left service providers with vacant beds for extended periods of time. The delay was costly for service providers, and in a couple of situations resulted in providers terminating their services. The lesson learned: it's critical to have a clear path for development and commitment to supporting an individualized transition plan for each client. This may mean providing the service provider with funding to keep the spot available for the client during their transition time. Currently, beyond a very brief startup period, regional centers do not have clear authority to pay to hold beds. And so, this was not true in the closure of Agnews. So for Lanham, that's what happened with our closure. Our recommendations at the department give regional centers the authority to provide funding to service providers during the critical transition time, allowing for the unique needs of each client to be the focus and the drive for the placement timeline, and not the vacancy and the lost revenue. In terms of leadership, communication, and commitment, acceptance of the reality of the closure by the on-site leadership and professional staff within the developmental center is critical. There was a lack of engagement and collaboration at the highest level of the facility administration, which allowed for a mixed message regarding participation and cooperation throughout the levels of staff. Our recommendation is that future transition efforts must have a mutual commitment and collaboration from both the community partners as well as from the leadership within the developmental center, so that there can be a smooth and coordinated transition for all individuals. Community preparation for medical services. The Lanham Developmental Center closure plan included a provision for enhanced funding for community medical specialists, which within the HMO structure. This enhanced funding did not materialize as it did with the Agnews closure.
You have 2 minutes, ma'am.
Okay, as a result, access to some specialized services for individuals have been very difficult to acquire, and it continues to be a problem today. We recommend that the state ensure the provision of enhanced funding for specialized services now, and will not wait until individuals actively moving into the community. One of the other things that occurred with us is that cross-training at the developmental center, the community staff is not allowed to do any hands-on training at the developmental center, and so that's a missed opportunity of training and getting to know the individual, and that has been one of the biggest reasons for the delay of a smooth transition from a client from the DC to the community. As the population of Lanham reduced, the transition planning for individuals were often hampered by the availability of knowledgeable staff or historical records. At the end, the staff that were familiar with the residents may have left the facility already. It created gaps in knowledge for the development of services, the transitions, and the understanding of the unique needs of the individuals in transition. Our recommendation is, as stated, collaboration and communication is crucial, starting now and continuing until the last person moves. Last one, rate challenges. The development of residential options was hampered by inability to attract new and specialized providers due to the low and frozen rates and the median rate structure. Regional centers are mandated only to negotiate up to the median rate, statewide or regional center, whichever is lowest. Some regional centers have a lower median rate, and service providers are reluctant to commit to development without a commitment to a sustainable rate. Presently, the health and safety waivers are the only means to adjust the rate. However, the health and safety waivers can only be requested for an individual client, not for a facility. Our recommendation is to give the regional center directors the authority to request a rate higher than the median rate for the facility, not per the individual, through the CPP process.
And I have to ask you to conclude here in 30 seconds.
Okay. A system should be developed for funding either bed holds or placements to transition similar to the Agnews closure. And for our 853 homes, the rate was significantly underestimated the need for the number and experience of nursing positions, and regional centers are supplementing through additional nursing authorizations to providers, using regional center nurses and employees to assist the providers in providing training, oversight, and monitoring beyond the funding regional centers receive for the oversight. Our recommendation is for the department to assess the nursing requirements for the 853 homes and provide additional operational funds, new and ongoing, for regional center monitoring staff, nursing staff specific to provide ongoing oversight oversight of the homes, and also for additional monies for nurses within that system as well.
That's wonderful. Okay. I really appreciate it. What I'm going
She's going to give that to us in writing.
I was just going to say, if it works
Said
for
to do it fast, so.
Hey, there we go. If it works for you, just because we have a significant number of panelists, would you mind submitting that in writing so we can give that
As long as you don't mind my scribbles?
No, it's all good. My goodness. And I not at all trying to be pushy.
I was rushing because you asked me to.
Hey, absolutely.
I was timing myself.
You did great. Okay. No, but thank you so much. And so we are going to be able to get that in writing from you. You can do that today or tomorrow or whatever works for you.
Before I leave.
That'd be wonderful. Right. Thank you so much, and thank you for participating today. It's good to see you. We are now going to hear from Jim Burton. He's the director of the Regional Center of the East Bay. Mr. Burton was really involved in the closure of Agnew's Developmental Center back in 2009, and he's going to be testifying about his experience with the closure, what worked, and most importantly, what we can improve upon. Mr. Burton, it's good to see you. You have 5 minutes, sir.
Thank you, Senator McGuire, Senator Mitchell, my Senator Lonnie Hancock from the East Bay. It's a pleasure to be here today. Regional Center of the East Bay, I'm the executive director of Regional Center of the East Bay. We serve 19,000 people with developmental disabilities in Alameda and Contra Costa counties. 113 of those individuals reside in state developmental centers, 110 at Sonoma Developmental Center, the largest group. So I've been asked in my comments today to describe the communication and collaborative process that existed between developmental center management and regional centers throughout the closure process at each facility and how that might be improved. How should lessons learned from previous closures be incorporated into future closures? Let me start by saying that the closure of Agnew's Developmental Center was the most ambitious and collaborative effort that I have ever been a part of in my nearly 40 years of service to people with developmental disabilities. Senator Hancock, I was excited then, and I'm excited now about the potential for us to do this and do this right.